Hi guys, thanks so much for joining me today. We are in our second video of our pathologies, and the pathologies that we're going to be talking about today are going to be atherosclerosis and coronary artery disease. So when it comes to atherosclerosis, it's a progressive hardening and narrowing of the arteries due to plaque. So as you can see in the picture here, you can see a regular blood flow or a regular artery with no plaque buildup, and then the one below you can see the plaque buildup in that artery, which is not good and not something we want. I have found that patients that are older than 50 are at higher risk of getting atherosclerosis. Some causes are from diabetes, smoking, obesity, high cholesterol, so high in LDLs, which is our bad cholesterol, and low in HDLs, which is our good cholesterol. Also, hypertension or high blood pressure can be a cause of this as well. So keeping that in mind from our previous video. So the next thing that we're going to talk about is the effects on vitals. So it results in increase in blood pressure and heart rate, such as that high blood pressure, and then we have a higher chance of stroke and pulmonary embolisms just because the blood is unable to get through smoothly, thus restricting the blood flow to certain areas of the body. Some medications that these patients are on are beta blockers, ACE inhibitors, and antiplatelets. Something to keep in mind with those beta blockers, that it's going to blunt or the heart rate and the blood pressure. So during exercise, we need to keep in mind that we need to use the Borg scale or the RP scale to kind of measure how much the patient is exerting themselves during the exercise. That'll give us a greater understanding on if the exercise is too hard or too little. So coronary artery disease is all it really is atherosclerosis in the coronary arteries. So the plaque buildup, but just only in the coronary arteries. So this can lead to a myocardial infarction or a heart attack. So we want to reduce that plaque buildup as much as possible. Similar medications are involved, and just being able to be aware of what they do to the body and how we can proceed during treatment. Some of the similar causes, such as diabetes, smoking is probably the #1 cause and a common theme you'll see throughout these pathologies, so keeping that in mind. So some lifestyle modification is good nutrition, so I do have a few videos up on some basic nutrition. If you guys want to go check those out, I highly recommend. Also some weight management and physical activity. Just getting up around and moving is probably going to be your best bet. Also reducing those modifiable risk factors such as smoking, food as well, so just keeping that stuff in mind. But there's a basic overview of atherosclerosis and coronary artery disease, and just keeping those risk factors in mind and to stop smoking. But I hope you guys learned something today, and thank you so much for listening, and on to the next.